This time, we will learn about injection therapy. We'll get started with intravenous injection first. Let's look at the purpose of intravenous injection. First, to provide moisture, electrolytes, and nutrients to the body. Second, to control acid-base balance in the body. Third, to maintain the therapeutic blood level of the drug through continuous intravenous injection. Fourth, to supply drugs and blood quickly in an emergency. Fifth, to have the rapid effect of the drug. Sixth, to provide nutrition to patients who have difficulty obtaining nutrients by oral intake. Lastly, to administer reagents during the test for diagnosis. Before preparing equipment, perform hand hygiene with hand sanitizer for at least 20 seconds until your hands are completely dry. Prepare necessary equipment and supplies. Check the medication list and the medicine label accurately and attach the medicine label to the fluid. Wipe the infusion port of the fluid bag with cotton balls with alcohol. Connect the IV set and fill the drip chamber with 1/3 to half of the fluid. Pass the fluid through the IV set to expel the air, then close the roller clamp. Go to the patient lying on the bed with prepared equipment. Introduce yourself to the patient. Perform hand hygiene. Identify the patient by asking the patient to state his name. Check the patient registration number and name by comparing the patient's ID wristband with the label on the fluid to be administered. Explain the purpose of the injection, the effect of the medication, and precautions to the patient. Hang the fluid bag on the fluid stand next to the bed and place the end of the IV set near the anticipated injection site. Assist the patient to be in a comfortable position with their arm placed below the level of the heart and assess the vein. Apply tourniquet 12 to 15 centimeters above the site with good veins. You should choose the injection site where the veins are prominent and straighter than the catheter to be inserted. Perform hand hygiene. Clean the puncture site with alcohol swabs using circular motions moving from the center outward. Fix the blood vessel by holding the part that is 2 to 3 centimeters away from the skin above or below the injection site with your thumb. Next, hold the catheter with the needle bevel facing up with the other hand and insert the catheter at 15 to 30 degree angle with the vein along the blood flow. Release the tourniquet. When blood flows back into the catheter, advance entire catheter lowering the insertion angle. Remove the stylet while gently applying pressure 2 to 3 millimeters from the tip of the inserted catheter with the other hand. Connect the prepared fluid set aseptically to the IV catheter. Fix the catheter insertion site using a bandage or a transparent tape so that the inserted site is not bent. Write the date and time of insertion and the size of the catheter on the fixed bandage. Release the roller clamp of the fluid set to check whether the fluid is injected and observe patient and any possible complications of the puncture site. After that, control the infusion rate of the fluid according to the physician's order. Ask the patient if he has any discomfort in the IV site and explain the precautions. Clean up the used equipment. Do not recap the needle. Dispose of the needle in a container for sharp wastes, and discard the used alcohol swabs and syringe in a container for general medical waste. Perform hand hygiene. Document the result and patient's condition in the nursing charts. The following are precautions for intravenous injection. First, check areas where intravenous injection is prohibited. An arm with an arteriovenous fistula, an arm on the side of having been under mastectomy, the limb with paralysis, and the site that has severe scar from disease or surgery should be avoided. Second, change the injection site from the far side to near the heart gradually when administering IV injection to patients who need intravenous injections for a long time. Third, select a thick blood vessel when administering hypertonic solution, antibiotic, and potassium mixed solution because they cause irritation to the blood vessel wall. In addition, be well acquainted with the exchange cycle of peripheral venous catheters and fluid sets. Peripheral venous catheters are exchanged within 72 to 96 hours for adults, but for children, they are not exchanged periodically if there are no problems. In the case of infusion sets, general fluids should be exchanged within 72 to 96 hours, blood units and TPN within 24 hours. Next, we will look at intramuscular injection. These are the purposes of intramuscular injection. First, to administer the drug deeply into muscle tissue. Second, to have rapid absorption and effect of the drug comparing to oral administration or subcutaneous injection. Third, to stably administer more drugs that stimulate the subcutaneous tissue. Perform hand hygiene. Prepare necessary equipment and supplies. Prepare the injection by checking the medication list and the medicine label accurately. Prepare medication in a syringe. The amount of IM medication is usually less than 2 cc. If the amount is more than 3 cc, it will cause significant pain in the muscles. Go to the patient lying on the bed with prepared equipment. Introduce yourself to the patient. Perform hand hygiene. Identify the patient by asking the patient to state his name. Check the patient registration number and name by comparing the patient's ID wristband with the label on the medicine to be administered. Explain the purpose of the injection, the effect of the medication, and precautions to the patient. Choose the appropriate injection site according to the patient's condition and the dose of the drug. Take the proper position and expose the injection site. These are commonly used sites for intramuscular injection. First, dorsogluteal site. Have the patient lay prone with the big toes pointed inward and expose buttocks. The upper outer part of the line that connects the greater trochanter and the posterior iliac crest, the site 5 centimeters below the iliac crest, or the upper outer quadrant of either the left or right buttock can be chosen as the injection sites. Second, ventrogluteal site. Have the patient lay in a left lateral position with his right knee bended and expose the buttocks. Place the palm of your left hand on the greater trochanter, your index finger on the anterior superior iliac spine. Extend your middle finger along iliac crest to form V-shaped injection area between your index and middle finger. Third, rectus femoris site. Expose the thigh while the patient is seated or lying down. Choose the middle third of the vastus lateralis muscle or the part of rectus femoris as IM injection sites. Fourth, deltoid site. Have the patient seated or stand or in a lateral position and expose his shoulder. Choose the outer part of upper arm, 5 centimeters below acromion process as IM injection sites. Clean the injection site with alcohol swabs using circular motions moving from the center outward. Let the site be dry, then pick up the syringe with one hand to remove the needle cap. Stretch the skin tight with one hand and inject at 90 degrees to the skin surface. Use the index finger and thumb of the hand that stretch the skin and hold the lower part of the syringe to stabilize it. Use the other hand to pull back on the plunger slightly to look for blood. If there is no blood, administer the drug slowly. If there is blood, discard the medicine and start over with a new medicine. When the injection is finished, apply alcohol swabs to the injection site. Remove the needle in the same direction as it was pushed and massage the injection site gently. Place the used alcohol swabs on the nursing tray and dress the patient with a hospital gown. Clean up the used equipment. Do not recap the needle. Dispose of the needle in a container for sharp wastes. And discard the used alcohol swabs and syringe in a container for general medical waste. Perform hand hygiene. Document the result and patient's condition in the nursing charts. Next, we will look at subcutaneous injection. These are the purposes of subcutaneous injection. First, to administer medication to patients who have difficulty in oral administration. Second, to administer drugs that are destroyed by the digestion process. Third, to obtain faster effective drugs than oral administration. Before preparing equipment, perform hand hygiene with hand sanitizer for at least 20 seconds until your hands are completely dry. Prepare necessary equipment and supplies. Check the medication list and the medicine label accurately and attach the medicine label to the medicine. Go to the patient with prepared equipment. Introduce yourself to the patient and identify the patient by asking the patient to state his name. Check the patient registration number and name by comparing the patient's ID wristband with the label on the medicine to be administered. Explain the purpose of the injection, the effect of the medication, and precautions to the patient. Perform hand hygiene. Remove the insulin pen cap and wipe the top of the pen with an alcohol swab to clean the area. After disinfection, screw the needle tightly onto the top of the pen and remove the cap. Set the dose for the drug. Clean the injection site with alcohol swabs using circular motions moving from the center outward. Lift the skin between thumb and index finger with one hand to tighten the skin layer. Insert the needle at the angle between 45 to 90 degrees and press the injection button. When the injection is finished, remove the needle in the same direction as it was pushed. Press the injection site with alcohol swabs gently, but do not massage. Put the cap on the end of the needle and unscrew the needle from the pen. Dispose of the needle in a container for sharp wastes, and discard the used disinfectant cotton and syringe in a container for general medical waste. Perform hand hygiene. Document the result and patient's condition in the nursing charts. Precautions for intramuscular and subcutaneous injection are as follows. First, when inserting and removing the needle, make sure that the syringe is not shaken as much as possible. Second, try to pull out the needle quickly at the same angle. Third, change the injection site for patients who need repeated injections. Fourth, be well acquainted with the drugs that are not allowed to massage after subcutaneous injection. Fifth, be aware of the sites that should be avoided for each injection. This concludes the injection therapy.